Hi, my name is Monica Williams. I'm an LPN to BSN student attending Indiana State University. The presentation today is on electronic medical records, taking a closer look at the ethical principles and healthcare policies. Populations at risk. Everyone that is involved with healthcare policies and ethical principles within the hospital are involved, including the patient. Healthcare professionals and health facilities have certain standards and ethical principles to uphold, and when those standards are not upheld, then it puts the patient and their care at risk. The learning objectives for this presentation is that the learner will be able to list different types of patient care technologies, cite 4 ethical principles, explain what HIPAA is, or HIPAA, explain what is a data breach, and list ways to potentially avoid data breaches. Please pause the video at this time and click the link below to take the pretest. Thank you. Patient care technology and ethical principles. There are a wide range of patient care technologies that healthcare professionals use. Some of them as simple as catheters and syringes, but as complex as computers, electronic medical record systems, and barcode medication administration. It is up to the nurse to advocate for their patients and find a balance when delivering patient care. And there are 4 main principles of ethics that as nurses and healthcare professionals that we can operate by to be able to find that balance. And it could be simply put, ethics could be simply put as the right and the wrong, or the correct and the incorrect. And I just want to talk about 4 of those ethical principles, and it's autonomy, which gives the patient the right to make their own decisions regarding their health care based on their beliefs and their values. The next one is beneficence. And beneficence is just simply the fact that the healthcare worker will do good towards their patient. Justice is that all patients have the right to be treated fair and equal. And the last one I want to talk about is non-maleficence, is that there is an obligation not to inflict harm on others as medical staff. Protecting the privacy and confidentiality of a patient is simply HIPAA, Health Insurance Portability and Accountability Act. And since we're talking about electronic medical records, we want to talk about data breaches. And we want to be able to make sure that the personal health information that we use from our patients is protected, it's kept private, and it's kept confidential. So in meeting the objectives in this presentation, we want to talk about imaginative and creative strategies for change. One of the things as health professionals that we want to make sure we do is that when we are not using our computers or electronic devices to review patient information, we want to make sure we exit the screen when those devices are not in use. We want to make sure we do not leave those devices open and available for other people to see that are not involved in the patient's care. Facilities can also invest in private screens to put on the computers. Healthcare professionals should not leave written or typed patient information in the public's eye. If we put anything in the shred box, we need to make sure that we mark out the labels with the patient's personal health information on it. We should not use workplace computers for personal surfing the web on social media sites like Facebook, Twitter, Instagram, and Snapchat, etc., because this can help alleviate hackers. Facilities can invest in two-factor authentication, where you will have to have two types of ways to enter into a device. It is very smart that we as healthcare professionals, or for anyone, do not use the same password on all of our devices, and that we should change our passwords frequently. And also use a password manager program to create unique passwords that nobody else will probably be able to decipher. There are many types of healthcare policies out there that we can talk about. And what a healthcare policy is, it's the decisions and plans and actions of a healthcare facility that are sought out to complete goals that are intended for the community. Um, An improved policy helps to reduce the effects on health disparities. It helps define goals, visions, and priorities. And there are many different policies in the healthcare system. There are patient care policies, employee health and safety policies, security policies, data privacy and information technology security policies, drug handling policies, administrative and human resource policies, social media policies, tobacco-free policies, and code of ethics policies, just to name a few. And there are some organizations that make sure that healthcare facilities are accredited and that they are meeting the regulations. And um, some of those organizations is the National Committee of Quality Assurance, Joint Commission or JCO, and Health Insurance Portability and Accountability Act. These are internal privacy policies. There are 4 categories of regulatory requirements for data security. The categories are administrative procedures, physical safeguards, technical security for data integrity and confidentiality, and technical security against unauthorized access. So these are some of the healthcare policies that are within the healthcare facilities. There are different financial securities resources, the Centers for Medicare and Medicaid Services, the Internal Revenue Services, and Financial Accounting Standards Board. These different financial organizations make sure that there are regulatory standards that are met within a facility in order for them to continue to be able to accept patients that receive those types of insurances and make sure they are meeting the standards to be able to bill for those patients. Here you will find some additional resources, and you can just click the link that will give you more information on ethical principles and healthcare policies. Thank you for reviewing my presentation on ethical principles and healthcare policies revolving around electronic medical record system and data breaches, making sure that the patient's information is kept private and confidential. Please pause the video and click the link below to take the post-test. Thank you. Please review this page as a reference page to the resources that were used for this presentation. Again, thank you.